next on Bodywork. Every man thinks that he's a breast expert.
You want a miracle. They're spectacular.
Wow.
How can I help you?
Fix my nose.
Total fee is $6,050.
And it's only money. You can't take it with you when you go.
Is someone living there? Knock, knock. Come on.
We're going to put an IV in.
I can change my face. I can touch just like you. I'm just like you. I'm just like I can't see no more.
The initial visit is $90. There is a $500 deposit. It's $850 today.
Worked in the high-end range of practices. We don't advertise. Our practice has been built solely by word of mouth.
No, we don't take insurance.
The doctor's fee is $5,000.
Victoria's Secret, $8,000.
And then neck lipo with excision, $3,700. So the total is the $5,300 down here.
Guess I won't be going shopping now.
Total is $10,613.
Okay. My investment for the future.
There you go. A very good investment.
You know what I don't like about my face is my nose. I don't like this big bump right here, and it's a little wide on the bottom. Sometimes I do have bad nose days. I'll wake up in the morning, it'll be huge. Some people think I'm crazy if I say that. The risk of going under anesthesia or having surgery, surgery totally wins. I wake up every day and look in the mirror, and sometimes I wonder, like, maybe I shouldn't be laughing and smiling as much as I do, because it's not pretty.
There's an extraordinary amount of pressure put on young women today to look perfect, and it's my job to help them achieve the best results possible. Hey.
Hi.
How you doing?
Good.
Carlos Wolf.
Hi, Randy.
Great. Okay, so how can I help you?
Looking to fix my nose. My name is Randi Rogers, and I'm 22 years old. I'm studying pharmacology at Nova Southeastern University. I've been thinking about getting my nose fixed for at least 4 or 5 years, and I'm finally doing it now because I feel like I'm at the perfect age. It's going to be really expensive, but it's totally going to be worth it. When I went to Dr. Wolf's office, I was so concerned about what I was going to look like. I didn't want it to change my face. I didn't want the nose job to change my look, really.
I know you're anxious about your profile, but I think most people look at you like this and they don't talk to you from over here. So what we're going to do is we're going to narrow the upper part of the nose like that, because you have a very wide nose here. And then in doing that, we're going to thin the tip out. At the same time, I'm going to take the bump down so that your nose comes right up. And I know what your biggest worry is that you're going to look like this.
Right.
Yeah.
I don't want my nostrils done. I didn't want it to look like I had surgery. You know, if I had just met someone and they didn't know me, I wanted it to be like they had no clue.
I'll have you talk to Ellen.
Okay.
And she'll talk to you about when we could do it, the timing, the cost, and all that.
Hi.
Hi, how are you? I'm Ellen.
Hi. Nice to meet you.
My pleasure. Hi, how are you? Come on in, have a seat. Okay. The type of surgery that you discussed with Dr. Wolf, okay, this is the cost of his procedure. It's $5,000. Then we bring in an MD doctor, and they charge $375. The $675 is our operating room, which is medications, drugs, anesthesia, supplies. Total fee is $6,050. And in order
I was shocked when Ellen told me how much surgery was actually going to cost. I wasn't sure right away, like, how I was going to pay for it.
everything would have to be prepaid.
I think that people really do think that we do it for the money. Obviously, we do make a lot of money doing this. But when it comes down to it, if we're not making our patients happy, we're miserable.
Hi.
Hello. Good.
That's good. going?
How have you been?
Very good.
Yeah, you look terrific.
Thank you. So do you.
Well, thank you. I'm trying, you know, a little Botox here, a little something, you know. If I can't fight it off, nobody can, right? I got all the tools at my disposal. So they tell me we're going to take a look at your breasts today. What happened to them?
I don't know.
You don't know?
We definitely need your help.
My name is Sardis Rodriguez. I'm 32 years old, and I came to see Dr. Herman for possible breast augmentation.
I used to have very nice breasts. I just don't feel that they're that way anymore.
So what do you want?
I want them to look full and not to be so droopy, and them to be the same size. Like, okay, like for example, if I want to go out on a date with my husband one night and I don't want to wear a bra that I can, and they don't look like...
If you want to be the same size and you want to be lifted, then that's a lift, okay? You understand? Mm-hmm. If you want them bigger, then you put in an implant. This would be the smallest possible implant I could put in you. That's a big C. Every man thinks that he knows what beautiful breasts are. Every man thinks that he's a breast expert, but they're wrong. I'm the breast expert. You want a miracle.
I know, right? A magic wand.
You want a magic wand.
Just like.
Before I've caught jacks, red drumfish, snapper. One's caught a stingray.
Stephen, from the day he was born, I mean, had big ears.
He was about 5 years old, 5 or 6. That's when the teasing started with the children.
Kids call me like big ears and laugh at me.
I can remember numerous times where Stephen has come home and said, you know, they made fun of me today. You know, so-and-so called me Dumbo ears, and I wanted to hit him.
Last year, he finally said that he wanted to do something about it. He was going on to the 6th grade, a different school. He could leave his teasing and his past behind him and just, you know, have a fresh start. So that's when we decided that we would go ahead and get something done about his ears.
The first surgery didn't work out as planned.
We were totally shocked when all of a sudden we noticed about 2 weeks later that one ear just looked totally different from the other. We were told that, you know, just wait in time and it would heal, and you know, time passed, and we knew it wasn't going to get better. It would only get worse.
I had to wait for a really long time to take the bandage off, and it was a pain. I couldn't go out for like the whole summer.
As a parent, you feel a certain amount of guilt, maybe having the wrong person from the get-go. So we're kind of hoping that he's thinking, you know, this time it's going to be great. You know, Mom and Dad maybe messed up a little the first time, but this time it's going to be great. I'm sorry.
I'm scared that it's going to end up like last time, and I don't want it to be like last time.
The morning was kind of tense. I had to borrow $6,000 from my dad. I was so nervous.
Randy, I'm Sarah. I'm going to be your nurse today. Come on in.
Okay, I'll see you in a few minutes.
Okay, I'll come and get you as soon as we get her ready, okay?
Randi is allergic. She is needle phobic. She will faint if she walks into, you know, like an emergency room.
Now comes the part I know you've been waiting and just dying for me to do. How are you doing, Randi?
When the nurse went to go stick the needle in my arm, I really was freaking out.
Can't get your bait. The resident IV expert take over. So I just left it.
Relax. Try to relax.
When the second guy tried to get the needle in my arm, I definitely thought I was going to lose it.
Take some deep breaths, man. You'll be okay.
Good morning.
Morning.
So how are you? Nervous?
Yeah.
Okay. We decided that we're going to have you go to sleep completely because you're just absolutely ready to jump out of your skin.
Yep.
Okay? Okay.
I think this surgery might change my life a little bit. It's not going to change me as a person, but I think for me it'll make me feel a lot better about myself. I am afraid just because of, you know, the mistakes that can be made. God forbid her not coming out of it for the hour that she'll be underneath. Like, I'll be in school, like, shaking.
Hey, sweetie. How you feel?
I'm just like you, I'm just like. I'm just like you, I'm just like.
I think of all the surgeries I do and of all the surgeries I've seen, the nose surgery is more likely to bring up a sense of angst and get you a little nauseous. Randy? He's very anxious about having a nose job look. I don't like that look anyway.
Maybe you may stink a little bit. Some medication I'm giving you right now, just to make you more relaxed.
Okay, let's just in here. Her nose is very wide. She also has a deviated septum. I'm going to make the incision inside her nose. We're going to narrow the upper third, take the bump down, narrow the lower third, and rotate the nose up. Nose surgery is aggressive, but it's a control aggression. First working on the soft tissue, in the cartilage. How's she doing? I think the most traumatic part about the nose surgery is when you're actually breaking the bone and you're breaking the center of someone's face.
Oh, yeah.
She's really very wide. The bones are wide because I haven't done anything to them, then I break them. And I do that by using a small chisel. Tap, 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 tap. Ooh, perfect. Ooh, I love that.
Oh, nice and crunchy.
I think I get my bleedings today, huh? Look how narrow. Then we put the cast in and it's over. Randy, open your eyes. It's Dr. Wolf. Randy. Randy.
Okay. Okay.
It's Dr. Wolf. Here's my hand.
Relax.
Randy,
Relax.
open your eyes. Randy, it's all over. You did great. I think we accomplished exactly what she wanted.
I'm gonna warm you up. You gotta get this on your arm. Can you bend your legs and put your feet flat?
I'll make you feel better. Open your eyes and see where you are. Randy, open your eyes. Just open your eyes so you know where you are. Randy? You want a miracle.
I know, right?
Why don't you just stick those in your bra and call it a day, okay? Take them off before you get too attached to them. Leave them here on the counter, okay, with that bra. Put your own clothes on and come on down to my office and we'll talk.
Okay.
Okay? Every patient has a different concept of what beautiful is. Come on in, have a seat.
Thank you.
In reality, you have beautiful breasts. You really do. They have a beautiful shape to them. They're firm, and they're a little saggy. I mean, a little. In reality, we're only talking about a little bit. I can tell you that I'm hard pressed to do anything because I think your breasts look that good. You know, it's a tough decision, but. You know, my recommendation would be to do nothing, to leave them as they are.
Oh, come on.
I feel bad. I feel bad because I always want to please my patients, but I'm just
like a little overwhelmed because I wasn't expecting this outcome from you here. Work with me.
I'm trying. You know.
Where's your magic wand?
Yeah, where's the magic wand? I told you, I think the battery's broke. All right. I can't just perform surgery on somebody to fill my pockets. Unfortunately, a lot of patients don't take our word for it and they do go elsewhere. Very often we'll see these patients come back with horrible scars. They really haven't gotten what they bargained for and now they want us to fix it.
Come on in this way.
I think his ears have caused Stephen to be a lot more shy.
We're hoping that the surgery changes his life. We're hoping that he just smiles a lot more and just has a good positive image of what a beautiful child he really is.
Hey, how are you?
Good, how are you? Good.
Hello.
Hi, how are you?
Good seeing you. How are you?
Good.
Good. Working on children is a lot of pressure. Not only do I have to make them feel safe, but I have to reassure their parents as well. Do the ears bother you?
What do you mean?
I mean, is it not pain-wise? I mean, you don't like the way they look?
Yeah.
After the surgery, they were in and they just popped out all at once, or over a period of time, or what?
Over a period of time, this one popped out. They were more in.
So there wasn't really much change.
What they told,
Okay.
well, I guess you'll be.
But you got to talk to me because this is about you. It's not about your parents. It's not about me. It's about what you want. So just talk about, tell me how you feel because I really want to I want to fix it for you. Does it bother you in school, or do people say anything or anything like that?
Yeah.
Yeah. Kids have no control. Kids say some nasty stuff. Yeah. Well, we'll get them back. Right?
Yeah.
Okay. Is there even a smile? Is someone living there? Knock knock. Come on. Come on.
It's too far back.
Well, I'm not going to make it too far back. I'm just giving you an idea. Okay? I know you're nervous, but we'll be okay with it. The whole key is to make his ears unnoticeable.
Miami plastic surgery.
All right, girls, Dr. Kelly is going to be in surgery
Next Wednesday morning?
Dr. Herman has 2 cases today.
And for Dr. Wolf, 3:30 is the last new patient. Botox you can do from 4 to 4:30.
Like 8 in the morning?
I'm not really here today.
I'm booked up for the next 4 months. I've got probably 100 charts sitting on my secretary desk of people who've already booked surgery.
You're in the office, general anesthesia, 3 hours time.
I always like being busy. There's a lot of pressure on us to get people in.
This is a mirage. A mirage.
My name's Anna Maria Kessel. There are things that I don't like about my body. I'm going to have surgery to have my breasts put back the way they were before I had children with maybe a little bit more enhancement. I mean, being a mom, you do a lot of things for your kids, and this is just for me. What am I going to do when I get them? I'm going to show them off. What do you think?
I think you should go with the
bigger?
The bigger one.
Yeah, of course you do.
Stand up, let me see the side one. Let me see the other side. That one definitely. I don't want to fall over. You're not going to fall over. This one's fine.
Anna Marie Kessel found me through her friend Sissy. She actually came down at the same time that Sissy was having her breast augmentation done. So I think she saw what happened to Sissy, liked it, and thought, hey, I'll do that too.
My name is Anna Maria Kessel. I'm a regional manager for a very large insurance company. I have a very supportive family with 3 kids, which keeps me quite busy. So nowadays, the time I actually have to spend with Sissy is precious to me. She and I have known each other for 20 years. We have a friendship that I don't think many people have had the opportunity or the benefit of experiencing. There's not a thing about me that she doesn't know.
Anything about what size you want to be?
Yeah, I kind of want to be back to the size I had before. I had all the kids and whatnot, so full B.
Let's
I
try.
think you should go with a C.
No, I'm not going with a C.
I always tell patients that they probably should err a little bit on the bigger side because things kind of lose projection a little bit over time. But, full B, small C, I think that's the size that's going to fit your body.
Ooh, he caught me doing that. I don't believe it.
Good. That's what happens when we play with breasts.
I have certain ideas of what a beautiful breast looks like. I try and discourage patients from going too big, so it's very rare for a patient to end up at D breast unless it really fits their frame. And
Keep your hands on your own breast. You got a brand new pair of your own.
take a look in the mirror and just see what you think.
We'll talk.
The right side is the smaller one. Right.
Given our relationship, I don't think this is anything odd for us. We have so many things that we have the same. I guess it's just something else we can add to our memory book.
How you feeling? You're so swollen.
Randi Rogers is coming in today, and I am exceedingly excited about seeing her because she has those incredible eyes. When all her nose settles down, it's going to be out of the ballpark home run. Hey, how you doing?
Good.
How miserable are you?
Just a little.
Yeah, you're just stuffy. How are you?
Good. You said it's a little gory.
It doesn't hurt. I'm just suctioning things down, okay? You want to see your nose today? Now, I have 6 feet of backing, like some of your friends probably told you guys have to, okay? I don't want you to look at you. You keep your eyes closed, okay? This is the worst part. No, don't pull away, okay? That's it.
That's it.
Now you're breathing. Are you okay? Did that hurt? Let me get the chart. There's a chart here. We'll just, this is doing, you know, the cold air.
It's like extra treatment.
This is value added. You feel okay? Huh? You feel pain? Breathe in. You know where you are? Where are you?
Yeah.
They always forget my name. It's unbelievable. It's amazing. I just operated on you 3 days ago. They can't even remember my name. This is a little uncomfortable. It does not hurt, although for you, you might be very confused. You know, the surgery was easy compared to... She got great eyes. This is going to be... Ooh, boy, this is... Ooh. Oh, my. Here, take it down here.
Looks great.
Beautiful. It's gonna look, she's going to look like she was born with this. Right here.
Wow.
Little difference. This is a view I love right here. I mean, look at how thin your nose is. And this is where you're ultimately going to be. See how nice and thin you are? No, I'm not pushing. I'm just gently touching. You feel okay? Okay, bye-bye. Take care.
Pleasure meeting you. Thank
Bye-bye.
you.
Relax. The next time, there's nothing to pull. All I'm going to do is put a little cream on, a little of that detachosol, and then I'll just be able to pull it off. Okay?
Yep. All right.
Bye-bye.
Bye.
Sissy and I went shopping today, and we went to Cosabella to look for lingerie.
Oh, look at this one. It makes her look fat.
Her first lingerie purchases since having her augmentation, or the twins put in, as I call them.
And what size did you give me here?
I gave her the biggest one I could find.
She's being so mean. Nervous?
Yeah, a little bit. But I'm nervous about the anesthesia. I'm nervous about what they're gonna look like when they're done. And I'm scared about the whole separation thing coming together.
What separation?
You know how you were saying you have to put them together and take them apart?
What?
Now I see more people on the street that don't have boobs. Because I notice more that don't have.
So we're gonna go home.
If I don't like them.
You're gonna be fine.
I'm absolutely worried they're gonna look fake. I don't want 2 tennis balls sitting up there, and big lines and... I have what I have, but at least it's mine. See, that's what scares me about the surgery thing, is that I like the way this looks now. Oh my God. Don't pull anymore. Take it.
What do you think?
Looks like there's a lot more there than there is in here.
Well, there is, but there was going to be a lot more in there like tomorrow. How does it look?
It looks big, man. I can't. Yeah, welcome to my world. Oh my God. Yeah, see, this is how we don't look alike anymore now. I am very anxious. Well, I like them when they're done. How will they look? Are they going to be right for my body? Are they going to look too big? Am I going to look fat?
You know what you're going to have to do? You're going to have to come back and get it.
Yeah, once I get the boobs.
Nobody's on my computer already?
It should be.
Okay. But is it like a, what is it called?
It's a folder.
Yeah, that.
Yes.
But
It's an icon. Yes, you.
On my.
No, I think I put it in your documents.
Oh, you didn't put it on my
desktop.
Yeah. Can't remember what all that stuff is called.
It's good use of technical terms.
Yeah.
Steven's got to be very nervous. When he had his first surgery, the one thing he kept telling me is, I never thought it would be this bad, Mommy.
I think the reason that he is so willing to go through with this surgery is because he's just so tired of being made fun of.
All right, Stephen, come on out here. Dr. Wolf's waiting for you. Mom, you can come too. And here's your Mr. Bear.
We're going to put an IV in. You know what the IV is. And it does. What's that?
I just want to be asleep.
Well, you can't for that. I can't. That's what we're going to use for you to go to sleep. You'll feel a little sting real quick. It's not bad, I promise. Let me explain something to you. I do this very quickly, and I usually don't do it, but I'm doing it because it's you. It's not going to go.
Wait.
Okay.
See there.
Okay, ready? Just take a look. Don't look. Ready? 1, 2, 3. That's it. We're in.
That's it. Is it going to stay there?
You're not going to feel it. That's it. We're finished. Let me just take a look at what we need to do here because this time I gotta make sure that. Okay? Okay, we're going to get started now.
Come with me, Stephen. Down here. Take your time. Bring Mr. Bear with you. We might need his assistance, okay? All right. See you guys. Give him a wave.
This is the second time he's going through the same surgery, so it's 2 summers that he's going to spend recovering.
It's awful to have a child go into surgery. You feel very vulnerable, just having him lie there, and you hope everything turns out right. You know, we had a bad prior experience, so you know we're nervous.
That's it. Okay. That's it. Leave it free. Let's give him some more. We're not doing any more.
Okay, all right.
Just Steven. Everything's great. We'll let that sit about 15 minutes. He probably had a little discomfort when when you get injected, but the medications we've given him are not only sedative, but they're also amnesic, which means he'll forget everything.
I guess you owe me more.
Steven's having surgery. He's actually having surgery to correct a prior surgery that he had last year. He's having his ears basically pinned back.
Now this is just getting rid of some of the soft tissue behind the ear, so that I have a space. We'll bring this in like that.
Yeah.
Much better. A little tougher than usual. So. Steven's surgery was tougher than usual because his previous surgery had been done incorrectly. He had extra cartilage in a scar area around the middle of the ear, pulling the ear back, and the rest of the ear, which was supposed to be pulled back, wasn't. Steven, you need to relax. Steven, go to sleep. Push it in there to fit.
Right before Steven was taken, I said, you know, everything's going to be fine. Do you trust me? And he said no. So I hope that Steven never has to think about this again. Whatever his ears look like now, you know, he'll be happy and it'll be totally natural for him.
Perfect. I had to form the fold in his upper ear to make it look normal, push his ears back from the bowl so that his ears would be more set back, and then I had to remove tissue from his earlobes to make them small enough that it would fit the rest of his ear. It's interesting. I don't see any stitches. I just feel a lot of scar tissue.
you. Still some extra tissue back here. Let me see. I think that's it. If Stephen never gets teased again, I will consider my surgery a success. Okay, I'm gonna grab. Stephen, open your eyes, buddy. We're finished.
People always notice that something's different, but they can't really pinpoint it. They're not really sure. They're like, "Did you change your hair?" I had surgery a month ago, and I love it. Love the results. I'm so happy.
Hey, how you doing?
Good.
You look beautiful.
Thank you.
Those eyes are absolutely like headlights. Boy, they are beautiful. Look how wonderful you look. See your profile. Oh, that is adorable. What do your parents think?
They love it.
Your eyes look unbelievable. You look like you were born with this. For the next 3 to 6 months, it gets smaller, the breathing gets better, and your nose is really going to change up to 1 year.
Okay.
And it's just going to thin out a little bit more here and a little bit more there. I'd love to see you in a couple months.
Okay.
Most people never come back.
I'll come back.
Take care.
Thank you so
Great,
much.
My pleasure.
Thank you.
My pleasure.
I do remember the day that Ellen told me how much surgery was going to cost. I did have to borrow money from my dad, and now I'm paying them back. In order to pay off surgery, I started waitressing at the Outback Steakhouse, and I work 5 or 6 days a week, but it's worth it. I'm going to be waiting a lot of tables for a little while in order to pay it off. Tables has its moments. It's strenuous at times, and then it's really fun sometimes, too. I think I probably do carry myself differently. I feel more confident about myself. I'm like all excited to get dressed up all the time now and do my hair, do makeup, look pretty.
I'm just like
Good morning.
Good morning.
How are you?
Fine.
Yeah?
A little nervous, but I'm fine.
Good, good. I'm going to set you up and mark you, okay? Turn your legs this way. Anna Marie Kessel had beautiful breasts to begin with. It's a lot easier to take beautiful breasts and make them even more beautiful than somebody who may have a lot of asymmetry or an odd shape. Those are more challenging things technically.
She was so nervous. She was so nervous last night. She was so nervous this morning.
We'll take good care of you. Don't worry.
Just make sure I wake up. Oh.
You won't have to worry about that.
Missy. Love you. I love you too. We're gonna be fine, okay? And I'll see you as soon as you get out. They're gonna come and get me. Okay? Okay? You're gonna be fine. Okay. Love you. Love you.
Anytime soon as well. We're gonna take the blanket as well. Because it's cold in there. Nice deep.
Like an irritation in my
nice.
Look up in the air. I'm going to give you a little oxygen. Take nice deep breaths. We'll see you when everything's all over in the recovery room.
I can change my face.
In Anna Maria's surgery, you make an incision in the armpit, then extend that incision behind the pectoral muscle using your finger. Then we use the endoscope, which is a little TV camera, to see what we're doing. We make that pocket a little bit bigger.
When you get through the muscle layer, you see the fat on the other side. Okay, so we're going to go with the 300cc implant. The implants are usually about 25 to 30 cc's different. 30 cc's is the size of a shot glass. Fold it up like a taco. Actually, it's more of a fajita than a taco.
We put the implant in, we inflate it while it's inside the patient, we take out the fill tube, and we close up the incision.
Okay, you can lower the table and sit her up. They're spectacular. Thank you, everyone.
Hey, you're freezing.
Freezing. Let me take a peek in there and see. Take a peek. Oh my God, honey, they're beautiful. What do you think? I can't see anything. I just want to be warm. They're beautiful, beautiful. No, hey, don't push so hard. There's boobs there now.
Yeah, I know. Nice ones too.
Have a seat. Have we run in? He looks great.
I think Stephen was very skeptical initially with the surgery that he would turn out the same or worse than last time. So we're seeing a lot of that anxiety, I think, has just melted.
Hey, how are you?
How
Look
are
at
you?
that.
Yeah, he's next.
How you doing?
I'm doing fine. How are you?
How you doing, Guy? I called him yesterday,
He
and he
told
got on
us.
the
We
phone.
couldn't believe him.
Have a seat here. Have a seat here. And so he said, he goes, "Who is this?" I said, "Well, I'm your third favorite person, the third most favorite person this week." He says, "Dr. Wolf." Okay. Now, do we keep this guy like this, or do we have to? We put him back to where he was. Keep him okay. I think the ears look great.
They look phenomenal.
When I saw my ears for the first time, I thought they were fixed and nobody was going to make fun of me anymore.
Everything is in place. Now his own body has to scar in, and that's what we're waiting for. Okay?
Perfect.
Take care.
Thank you.
See you in about 3 weeks. Enjoy it.
I think I feel relieved that I look different.
The best part of the whole procedure that Stephen has gone through is to see a smile on his face. The change being, an introvert to he is an extrovert now.
It's really great to be able to have him trust us again.
I can go outside and be myself and just have fun and not worrying about people making fun of me anymore.
I want to see those.
Hey, did you have surgery? Man! I talked to her last night. She was like, "Oh yeah, I've been outside, no big deal."
How are you?
I'm great.
I can't wait to see you.
God, I can't believe
How perky I am?
great, how well you recovered.
Look how amazing she looks.
Oh my God.
I haven't seen you.
Nobody looks that good this soon after surgery. That's fantastic. That is awesome. Beautiful. Absolutely beautiful.
Beautiful. Beautiful.
Fantastic. Most people don't look this good this soon.
Really?
Yeah.
I guess I probably should look at them.
Absolutely. Absolutely.
Wow. They look great.
Yeah, they do. They look awesome.
Awesome. They look really good, you guys. Wow.
Hey, Mike.
I gotta let you in on a little secret here.
Uh-oh.
We've got a little surprise planned for your birthday and also to celebrate the fact that we've been partners for 5 years. I'm not gonna tell you where we're going. We're just gonna go and we'll see how things evolve.
What are you guys doing?
Can't tell you. Can't tell you. It's all a surprise.
That's so funny. That's why I was thinking, why the hell doesn't anybody know what the hell's going on? Michael has kind of kidnapped Brad and I. No.
What's that?
Wait, are we going in this helicopter?
I guess he owns no more.
Dr. Kelly gave us this whole ruse that we were going on a photo shoot, and then when we got ready to leave the office, he kind of sprung it on us that there was no photo shoot, but he still wasn't going to tell us what it was. You don't have the Paris Hilton video on here?
No, I have Curb Your Enthusiasm.
Hey, Meredith, how are you?
Michael has kind of kidnapped Brad and I for our birthday.
when he found out that we're having.
What's that?
Wait, are we going in this helicopter? We're going somewhere. I don't know. We're
going somewhere. I don't know where we're going. I guess you spoke to Mike.
I had already had plans with my girlfriend that night to go to dinner for her birthday, and I was dying that she was going to be furious with me.
But we're going to get a helicopter, and I'm not going to be.
Are you all right?
Going home soon.
Okay.
I don't really know.
I don't know what time
we're
we're coming back, so
we're here with Mike and Brad, and we're going to go in. Sorry. Going back. I don't. Is this for real?
Okay, thanks.
Hey, how you doing, guys?
The next thing we know, we're in front of this helicopter going to God knows where.
This is how I usually come to work. Is this a surprise that you just bought this for us?
There's some surprises. We all bought this.
Right now.
Shopping's always been my favorite pastime, so I don't know that I shop any more than I did. I just probably shop with a little more excitement. Oh dear. When I went back to Cosabella, instead of wondering what shirt would look good with my breast, I just picked the shirts I liked. Oh, weird. Medium. We went from small to medium. This is not gaining any weight. There are still days where I don't feel particularly attractive, but then I'll put on a low-cut shirt and feel a little better about myself.
It's like a little dress. That's to sleep in. Right? Yeah.
My breasts, I believe, are just right. I believe that as the time goes on, they'll dry, and they're going to be perfect.
Well, that looks good. Oh, yeah.
I'll be right back.
It looks really good. It looks great with them. Yeah, the girls look good. It's just their new hips back here. Oh, my God. They're a real thing. You take force on them. Oh, this is going to be the one time that you're spending less than me. It's very sad. And it's only money. You can't take it with you when you go. Thank you. Have a good day. You too. Thanks.
A feeling that I wanted to have something done to treat myself, and I did. And I love the results. And it was just a great experience.
The helicopter ride was to celebrate their birthday and also to celebrate the fact that the three of us had been together as a group for 5 years.
I've never been in a helicopter over Miami, over my own city, and it's amazing to see your own city from a different perspective.
I think Brad and Carlos were genuinely surprised when they saw the helicopter. I really don't think they expected that.
Hey, Mom, how are you? Why am I in a helicopter? How'd you know I'm in a helicopter?
And then the next thing we know, we're landing at Opelika Airport, and there's a limo waiting for us. But it still wasn't going to tell us where we were going.
5 years. It actually seems like we've been together much longer, but it seems so compounded.
It flies.
Well, we are going to the ball game.
Okay.
The reason we're going to the ball game, a few years ago, Carlos and I went to a Dolphins game. We were walking by the helicopter pad. He turned to me and said, "You know what? That's big. If you can fly a helicopter to a ball game, you're big." He goes, "We'll never be that big." So the whole point of this is to prove to you we're that big, all right? Got your Marlin cap. Brad's definitely the black cap.
You know that I have never been to a Marlins game.
You're kidding.
Never.
You know what's great about this,
do we have to take the tags off them?
All right.
Ooh, look
there
at that.
These are great suits. So great.
These are great suits.
You know, one thing that Carlos said to me was he had only been surprised once before in his life. So I think for him it was just a real special thing that I would take the time to do that for him.
Unbelievable. The game was great and the Marlins won.
Change my face, I can touch and taste, I can write, erase, just like with a little restraint. I'm just like you, I'm just just like I guess. Oh.